Current advancements for the treatment of sleep disorders. First, let's just talk about sleep in general. Sleep is a system of relaxation used by most of the body, except for the brain, which is active during certain parts of sleep. Only because the sleep occurs in cycles that are about 90 to 120 minutes each, and they're cycles of rapid eye movement sleep and non-rapid eye movement sleep. So sleep occurs in cycles. Here's just like a basic graph. So up at the top, you have areas of light sleep, and then the bottom you have deep sleep. Now, commonly at deep sleep is known as NREM, or non-rapid eye movement sleep, and then at the top, the light sleep, is REM sleep, or rapid eye movement sleep. So, sleep begins with the cycle of NREM sleep, which starts off as a light sleep and then moves to a deep sleep. During NREM, your brain and eyes aren't moving, but your body might, and so this is when sleepwalking occurs. And the body also performs maintenance, like it rebuilds muscle tissue and grows during our NREM. But after about 60 minutes of your body being in NREM, the sleep transitions to REM sleep, where your body is paralyzed, however your brain and eyes are active. And also, with your brain working, that's when you experience dreams. So the strange thing is, REM periods, they're not all consistent in length. They start off at 10 minutes, but by the end of your sleep, your REM periods are lasting 60 minutes. And each time REM ends, you either go into another cycle starting with NREM, or your body wakes up. Now let's move on to some sleep disorders. The most common is sleep apnea. It's the most common sleep disorder, and pretty much what happens in sleep apnea is the person's throat muscles relax too much while they're sleeping, so the flow of air to lungs during sleep is blocked. The brain, obviously then, because it's not receiving oxygen, starts forcing the body to breathe. And so oftentimes when you start forcing them to breathe, you're going to wake up with a choke. Commonly, one of the symptoms people realize first is that they snore while they sleep, because there's an obstruction in the throat, so you're going to snore. A direct effect is an overall feeling of fatigue because, like I said, they wake up at night with a choke, so that really disrupts their sleep pattern. But indirect effects of not getting enough sleep include high blood pressure, heart disease, and strokes. And so that's really why it needs to be treated to avoid these indirect effects. There are some treatments, though, for sleep apnea. For some people, they just need to lose weight, and that treats their sleep apnea. Sleeping on the back, which is one of the common factors that makes sleep apnea occur, worsens it. But some sleep positions actually improve the flow of air, so those help. Or you could undergo surgeries to correct the obstructions in the throat. Recently, some devices have been created to treat sleep apnea. CPAP, this is a very common treatment for sleep apnea. It stands for continuous positive airway pressure, so that's very common treatment for sleep apnea. It's basically a mask worn over the nose and mouth, and so it's hooked up to a machine. Over here, machine. Very artistic rendition. And so what the machine basically does, it pumps a continuous stream of air, pretty much keeping the throat open because there's like air pressure. And so that pretty much keeps the obstructions open so you continue to breathe through the night. Or you could treat it with a bilevel positive airway pressure, or BPAP machine, which is similar to it pretty much does everything the CPAP does, except it changes the machine's flow of air to like kind of mimic breathing in and out of the body, so it's more natural. The Inspire is a really recently created technology, so it's pretty much the Inspire. It's placed in the patient's chest, and so it has two wires. One wire extends out to like the lungs, and it finds the patient's natural breathing rate, and also another one, it goes up to the throat, and pretty much what this wire does is shocks the muscles that control the airway, and pretty much keeps those open with the shocks. The shocks like contract the muscles, keep the airway open, and it can be remotely controlled. So if the doctor needs to control it, he can control it, or if you need to control the machine, you can control it with a remote. So it's a pretty innovative machine. And also you can have your dentist design a special device designed to keep the airway open during the night. Those are common among sleep apnea patients. Insomnia is the next sleep disorder. Insomnia is its general term. It can have a lot of symptoms: poor sleep, difficulty to get to sleep, waking up too early, or like generally feeling tired all the time. Temporary insomnia is the first kind of insomnia. This is just it's really common if you experience anxiety, tragedy like a death in the family, or jet lag is really common too among people that travel. But the more medical kind is chronic insomnia, which just it's long-term insomnia. It could be caused by other conditions such as dementia, but sometimes it just occurs randomly on its own, and this is known as primary insomnia. And this is mostly, if you're going for medical treatment, it's mostly not temporary insomnia because that just goes away over time, or chronic because then you just treat the source condition. But primary insomnia just occurs randomly and it's long-term. It's really detrimental to health. It could be caused by age. It's really common among older people. Stress, which obviously most people experience stress disrupting their sleep pattern, but it could cause primary insomnia. Or certain medications really limit your sleep. 40% of adults have insomnia. That's a shockingly large number for me when I found out about that. And long-term insomnia, just not getting enough sleep, it's really detrimental to overall health. Your mental health, your brain gets really damaged by that, and also your physical health. Your body really needs sleep to function. There are some treatments for insomnia, ways to help the symptoms. Forming sleep habits, like going to bed at a certain time, waking up at a certain time, those can really help those who have insomnia. Or medications such as sedatives, those can help get to sleep, so treat that kind of problem. Also, like the chronic kind of insomnia, you treat the source disorder. Relaxation exercises like deep breathing. Those are often used to treat insomnia, especially if you do it right before bed. A lot of people do that. And daytime exercise can improve the quality of your sleep. Narcolepsy. This is the next sleep disorder. Narcolepsy. It's a pretty strange sleep disorder. So it's characterized. If you've heard of it, you've probably heard of how it causes you to lose control over falling asleep. And this is really caused because those with narcolepsy, the REM stage of sleep that we talked about earlier, I think, right here, the REM stage of sleep, which is where all the dreams and other things occur. The REM stage of sleep, it's just triggered randomly, so you just fall asleep at random time. If they're walking around, it can happen. If they're eating, it can happen. If they're just playing a sport, it can happen. It can happen anytime while they're awake. There's a whole lot of factors that combine to create narcolepsy, such as chemical imbalances and certain systems in the brain functioning improperly. These combine to cause narcolepsy, to prevent someone from having control over their sleep. So there's four main sleep symptoms of narcolepsy: excessive daytime sleepiness, which is falling asleep during the day, like I've talked about. Cataplexy, or random loss of muscle control. Hallucinations, and sleep paralysis. Now, sleep paralysis it occurs a few minutes after you wake up, and so it's pretty much like your brain's conscious, but your body's still asleep. So you're conscious, but you can't move. However, narcolepsy often goes undiagnosed. A lot of cases in the U.S. just aren't diagnosed, aren't properly treated, because doctors usually only diagnose it to those who have symptoms of excessive daytime sleepiness. But there are other side effects that tell you that it's narcolepsy, you just aren't treated properly. And narcolepsy usually lasts your entire life, so it's hard to cope with, especially if you don't get that treatment. It can really disrupt your life. And narcolepsy also has links to other disorders such as migraines and obesity. Again, tying into that, how hard it is to cope with. Thankfully, there are some treatments for narcolepsy. Medications, especially stimulants to prevent falling asleep, are used often. A regular sleep schedule, like insomnia, like if you're sleeping enough, that at least 7 hours. If you're sleeping enough, it can really help to not fall asleep during the day. And several small 15-minute naps, just really short, those often help narcoleptics to not fall asleep during the day. And exercising regularly, like some other sleep disorders, exercise, it helps your sleep cycles. Night terrors is the final sleep disorder I'm going to talk about. Mainly among young children, 3.5 years old, and they occur during late NREM sleep. And they're not nightmares. They're two separate things, because nightmares occur during the REM. Go back to the chart we talked about. Night terrors occur during late NREM, so like right here during the deep sleep, whereas nightmares occur during REM, so up here in the light sleep. A night terror occurrence is very strange. During an occurrence, the child becomes unresponsive. So, like, they won't respond to comforting by the parents, or they won't respond to talking by the parents. They'll just continue on with the episode. And so during it, they sit up in bed and start to scream, and then after that, they may thrash around, cry, and act generally fearful. Other things that could happen during an occurrence are sweating, hyperventilation, increased heart rate, and appearing to stare. They sometimes just, while they're sitting up, they just appear to stare at something in the distance. Creepy. The whole experience can last anywhere from 1 minute to 30 minutes, so it's a pretty long range for these kind of episodes. And around 3% of children experience this during their early years. One of the strangest things about night terrors that I found while I was researching it is that most children who experience night terrors won't recall the experience the next day. Only a few will actually remember it. There are some causes for night terrors, like fever, stress, and sleep deprivation. Those can contribute to having night terrors, but sometimes they just occur on their own. Treatments, most times they don't need a treatment. They're usually outgrown. In really extreme cases, tricyclic, I hope I pronounced that right, probably not, antidepressants are prescribed, and those can help prevent them. Minimalizing the child's anxiety, like stress was talked among the causes. If you can prevent the stress, then you can sometimes prevent night terrors. And one strange treatment I found was, but it actually kind of makes sense, if the child is woken up, if it happens more than once, you figure out when they occur, you wake the child up 15 minutes before it occurs, keep the child awake for 5 minutes, and then send them back to sleep. That can prevent the night terror from occurring. And here's the bibliography.